Welcome to our December FSR forums. I am your host, Dr. Gillian Gordon Perue. I'm a stroke neurologist here at University of Miami, and I serve as the director for the educational core of Florida Stroke Registry. Today, I have the esteemed honor and privilege of welcoming to FSR forums, Dr. Negaris Daghi. She's an associate professor of neurology, also at University of Miami, and she wears a second hat. In the FSR, she is our Publications and Research Outcomes Director and has led our Publications Committee for quite some time. It is an honor to have you here. Welcome, Dr. Daghi, to FSR Forums.
Thank you, Gillian, for having me. It's great to be here, and thanks for your invitation.
Great work so far by the Florida Stroke Registry and really all our stakeholders. They're the ones who make all of this possible. We have been very busy in publications as well. Are there any special publications this year for 2024 that you'd like to highlight for us from the Florida Stroke Registry?
Yes, indeed, there are multiple really exciting publications. I will highlight a few, but I encourage everyone to please check our website to check the full list of publications and all the science that's coming out of the Florida Stroke Registry. As part of our Transitions of Care program, we have two publications, both led by Dr. Carlin Johnson, looking at adequate transitions of care. Dr. Johnson has been able to create a score for adequate transitions of care. So things like compliance with medication and exercise, behavioral changes, nutritional changes, and really healthy lifestyle modifications that are not really formally evaluated as part of bigger research. And so adequate transitions of care has been associated with really an impact on better outcomes after stroke. So I want to highlight his publications. We also have publications from the main FSR on looking at patterns and outcomes of octogenarians, nonagenarians, and people older than the age of 80 after they have presented to the hospital with an ischemic stroke and undergone endovascular thrombectomy. This is a really interesting paper that is accepted and published in JAHA this year, and really basically highlights that over a third of patients that currently receive endovascular thrombectomy as part of routine care are indeed older than age 80, and this is a population that is either entirely excluded or severely underrepresented in randomized trials that approve this therapy for us. So important highlights, make sure to check these publications.
Yeah, I look forward to it. You know, in Florida, we are one of the oldest, if not the oldest state in the nation. And so it's really not just publications for the sake of publications, but very practical here for us in Florida, since we have a lot of retirees here. So I'm looking forward to that paper. The team did excellent, and I encourage all our listeners and our FSR forum stakeholders to go and check it out. Today, I am joined by Dr. David Rose, who is a professor of neurology at University of South Florida in Tampa. He's also the co-director of the neurocardiac unit in that space. And for us here at Florida Stroke Registry, he has been a longtime collaborator, contributor on our publications committee. We are excited to have you join us today on FSR Forums. Welcome, Dr. Rose.
Pleasure, Dr. Gordon Perue. It's nice to see you again.
I'll say that, you know, as a longtime contributor to our publications committee, we've been excited to work with you. You've done great work. Florida Stroke Registry is not just a registry. It really is a program advancing care across South Florida. And so we work on advancing the science as well. So could you share with us what are some of the exciting bits of science coming out of the Florida Stroke Registry this year that you've been excited to learn about?
Absolutely. One of the things that I was very proud to do, to lead with the FSR was the COVID-19 data.
Yes.
Now that that's over, you know, we can move on to other topics, but very briefly, what we showed with that was that FSR adherence to the 7-metric domain known as defect-free care, DFC, was able to be maintained even during all of the challenges that we faced during COVID-19. So we're very proud of that. We saw an increase.
And proud of our stakeholders, right? Because they're the ones at the front lines that make this happen, that maintain it despite COVID. Wow.
Yeah. So we finally got that out this year. But one of the things that I was very proud to see you lead was the FSR 10-year review of antihypertensive prescribing practices and the disparities, that were noticed. It's so important for us to really look at guideline-based hypertension management to prevent stroke. And it's so frequent. We see this in practice that people do whatever they want to do. Or don't, right? And so this is not just patients, it's also us.
Next slide. And the big question is always, does it make a difference when you actually follow the guidelines? And are we likely to follow the guidelines more for one group of persons versus the next? And patients for whom we do follow the guidelines, these are the rules for the guidelines, actually do better. So it makes a difference when you're stopping and thinking about antihypertensive medications for our patients.
Right. Not just semantics. These are time-tested, time-honored rules that we really should be following, that we're just, in general, I don't want to paint everyone with the same broad brush. There's a lot of us who do try to adhere to guidelines. And there's always exceptions to every rule, of course.
Exactly.
But
and sometimes it's a matter of documentation. What's the exception, right? Maybe there is an exception to the rule, but we can't see it in the Florida Stroke Registry. And so this might get us to document a little bit better why we're choosing what we're choosing.
Right.
Yeah. Next slide. So I think this is pretty impactful for Florida stakeholders, and more to come on this guideline-based adherence to prescribing practices.
Right. And to be fair, there is a JNC6, a JNC7. The guidelines do move. Not a lot, granted, but they do change over time. And it's good that
keeping up.
Yeah, we certify and we show up to the meetings and learn about this stuff. But at the end of the day, a lot of what you found was that we're not even adhering to that, even the old JNCs. So we need to beef up our game across the board.
Or document to say why we're doing otherwise, right? But I think this is exciting. Hypertension, of course, as you know, is the most common stroke risk factor. About 70% in Florida Stroke Registry have hypertension. So definitely an area for focus, and exciting science to come out of the Florida Stroke Registry this year, for sure.
Yes, an opportunity for monitoring.
Quality improvement, what we're all about.
Improvement studies, more research is absolutely needed.
Yeah, nice. So that's sort of one of your favorites out of Florida Stroke Registry this year. But as a scientific community, the stroke field has been galloping leaps and bounds this past year.
Yeah, for the past couple of years, we've made great progress in ischemic acute therapies, moving from TPA to TNK now, moving from LVO to MEVO. But I think one of the things that's been neglected, quite frankly, for all these years is intracranial hemorrhage and under-researched, maybe a better word, and also pre-hospital stroke care. We kind of don't really do much research at all on that. So I think one of the biggest impactful articles this year came from New England Journal, not from Stroke or Neurology or one of our other favorite journals, but actually Craig Anderson's study, the INTERACT-4 study, looking at intensive blood pressure lowering in patients with acute cerebral hemorrhage and intracranial hemorrhage, what they called undifferentiated stroke. So they picked someone up in the field with a Chinese study in China in the ambulance and didn't have a CAT scan or any fancy tools or equipment in their ambulances, and treated them to a pretty aggressive blood pressure lowering goal. And found out that actually for intracranial hemorrhage, these folks did about 30% better than the conventional arm, but for ischemic stroke did about 30% worse.
Right.
So it was kind of a neutral study in the undifferentiated stroke population, but if you subdivided it, you saw a big difference between ischemic and hemorrhagic outcomes.
So talking about amazing science and noticing your background behind you, you also are the section editor for the American Heart Association Stroke Journal, and you do the Stroke Alert podcast. I've had a lot of fun listening to that, I can tell you. I listen to it while I'm driving to work, and I spread the news. And as much as I'm, steeped in academia, I always feel like I learned something. And so tell us what's happening in December. I know you do a year-end review. If you'd tell us a little bit about that. There's been so much exciting science, from Zodiac to StopCAD to the ICH alerts. What made it to your top list for 2024 in landmark trials?
Well, thank you, Gillian. Let me just briefly mention that, of course, our founder and past executive director, Dr. Ralph Sacco, was also the former editor-in-chief of Stroke.
Yes.
Of course, with the passing of Dr. Sacco, the world continues to mourn his loss. And one of the ways that we can continue to keep his memory alive is really doing what was very close to Ralph's heart, which was reducing disparities in access to scientific work. So Ralph, as you know, was a champion of disparities in access to healthcare, and disparities in, access to medication and treatment, but also reducing disparities in access to scientific work. So every year since his passing, the December issue of the podcast is dedicated to his memory. And basically we have the Ralph Sacco Review of Science. So this year I had the great honor of hosting one of Ralph's previous mentees, Dr. Ashu Jadhav, and review top science, either presented or published in 2024. So you already mentioned a few of those trials. I'm going to highlight a few other trials. We went over some of the great science published or presented in the mild stroke space. So we had the publications of the Tempo 2 clinical trial that really was addressing an important gap in knowledge with regards to acute managements, thrombolysis versus maximal medical management of patients presenting with a mild ischemic stroke and a target visible intracranial occlusion. The results were published in Lancet in May of 2024.
That was a good one. I was surprised by the results.
I know, disappointing, but important. We also highlighted a lot of science that's been happening in the world of intracranial atherosclerotic disease. We've had for years and years, for upwards of 10 years, data from prior randomized trials on looking at stenting versus maximal medical therapy in patients with symptomatic intracranial atherosclerotic disease. And this year we have some very exciting new science in that space to look at the outcomes of long-term outcomes of stenting, and also look at angioplasty, a treatment that may be better tolerated than stenting. So we reviewed the long-term outcomes of CASIS, which was published earlier in the year. We reviewed the BASIS randomized clinical trial, as well as reviewed the very exciting randomized trial Angel Reboot in the podcast. And finally, I want to mention that there is a lot happening in the hemorrhagic stroke world, and I don't want to sort of leave that behind. You mentioned about the ICH and the bundle of care. ICH, the Interact 4, was an important clinical trial that included both ischemic and hemorrhagic stroke in the pre-hospital space. We didn't cover that in the Ralph Sacco Review of Science, but we really mentioned the importance of hemorrhagic strokes. We can potentially do an entire session on new developments in the field of hemorrhagic stroke alone. I will say that also just this past week, we have 3 randomized trials on middle meningeal artery embolization for treatment of
Yes.
subacute to chronic subdural hematoma. For all of this, I encourage you to refer to the podcast. We have interesting conversations about these new therapies. Very exciting time for hemorrhagic stroke. And we're excited to close this year's Ralph Sacco with all of these interesting and developing science.
Wow. Thank you so much for summarizing that for SFSR Forum viewers. We will have links to each of these things for you. We look forward to the great science coming up in 2025. The future for stroke looks very bright.